Hello guys, welcome to my YouTube channel. So this is going to be my first video of my weight loss journey through weight loss surgery, and this video is going to talk about how I got this ball rolling, my pre-screening I had to go through, and appointments that I had to get through in order to get my surgery date. So basically I already had a appointment with my primary care physician. I asked my mom to tag along because my mom is a excellent patient advocate and she advocates for herself all the time, so she knew exactly what to tell me to get my doctor to make that referral. So she basically told me to tell my doctor that I tried everything, which is true. I've tried different type of diets, different type of diet programs like Weight Watchers, diet pills, diet supplements, exercise, and it's just really hard for me to lose the weight by myself. So I explained that to my doctor. I also, explained to her kind of the emotional side of my eating. I'm a very emotional eater, so I eat happy, sad, depressed. It don't matter. I just feel like I need to eat. And just telling her why this surgery is important for me to get and why I want it. And I've been thinking about doing this surgery for a long time. I was overweight before I had my son, but after my son, it really got out of control. So I need some type of help. So in order to qualify for weight loss surgery, you need to be over a certain BMI, which is 40. I was, my BMI was well over 40. I think my BMI was at a 45. And when they weighed me, I weighed 293 pounds, which was the heaviest I've ever been in my life. So I knew I needed to make a change. After talking to my doctor, the appointment went very well, and she gave me a referral to these people called Valley Care with Stanford, and they're in Pleasanton. So once I did the referral and they faxed it over, a lady called me from their weight loss clinic, and she started setting up all of these appointments. So this is where things can start to get a little overwhelming. There are a lot of appointments you're going to have to go through, a lot of hoops you're going to have to jump through in order to get your surgery date. So if you're somebody who is just I don't have time for all of this, then this probably is not for you. If you're somebody who is not willing to sacrifice, because I had to make a lot of sacrifices, then this is not for you. But if you're ready and you're I'll do whatever it takes, then I'm here for it. Go for it. So my first appointment was with my surgeon. So I got to meet her. My surgeon name is Dr. Estacari. She's awesome. She's amazing. She's really good at what she does. She does these surgeries every week for the past 10 plus years. She's very, very good. All of her patients have been able to lose the weight, maintain the weight. Her risk factors are very low. She doesn't have complications with any of the surgeries she does. So we was just kind of going over why I wanted the surgery, again, my emotional eating and everything like that. So we kind of filled out this little sheet, and this is her explaining to me how the surgeries were going to be done, what she was going to do, what it was going to look like, the risk factors of both surgeries. So one is the gastric bypass, the other one is the sleeve. You don't always get to pick which surgery you get. The sleeve can have a lot of acid reflux. So if you're a person that has acid reflux, then the sleeve wouldn't be for you. But luckily I don't have acid reflux, so I was able to choose which one, and I chose the bypass. There are risks to any surgery. You can get blood clots, gallstones, there could be a leak in your pouch, but her percentages are very, very low, 1%. So I just felt better with the bypass. The sleeve didn't really resonate with me. I just felt more comfortable with the bypass. So she also told me that I needed to lose 10% of my body weight. The surgery is done laparoscopically, so they're gonna make 5 little incisions in your stomach and go in with tools to do surgery, and they need you to lose that 10% of your weight, which was 14 pounds for me, because they want your liver to shrink, and if your liver is smaller, then they can maneuver better within it. So after I had the meeting with the surgeon, I went and I spoke to my patient advocate, and that's going to be the person that's going to advocate for you. If you have any questions, if you have any concerns, that's the person that you talk to throughout this whole thing. She's going to be in constant communication with your primary doctor, trying to get any other medical information that she needs from them. And she also gave me this lovely binder. So it's everything and anything that I need to know about my journey I'm going through. It has little different tabs. So it talks about the program, diet and supplement, pre, post-op care, exercise, prepping for success, lifestyle changes and resources. So we went over this binder. I had to read this whole thing. I had to do quizzes on each section. They just want to make sure that you're really knowledgeable and know what you're getting yourself into. So there are some things that you have to do prior to having surgery. So 30 days prior to your surgery, you have to stop drinking alcohol, don't have any major dental work done, no smoking. So whether you're a weed smoker, whether you smoke cigarettes, like, you're gonna have to stop. You're gonna have to make a lot of sacrifices and a lot of changes in order to get this. 14 days prior to surgeries, things that you have to stop doing 7 days prior. So right now I'm kind of at the 7 days, so I have to shower in this antibacterial soap twice a day, you know, just to make sure I don't have any unwanted bacteria on me when I go in for my surgery. Also definitely need to floss and brush twice a day to eliminate any oral bacteria. Right now I'm in the process of getting all of my medications I'm going to need for before and after surgery. So that's kind of where I'm at right now. So now after my patient advocate, I am at my nutritionist. So again, the nutritionist is going to talk to you about your bad eating habits, why you do the things you do, what you need to do. So they're going to put you on a low carb diet. So that literally consists of meats and non-starchy vegetables, and like eggs and cheese and different stuff like that. It's kind of a lot like keto, basically keto, like, you know, if anybody is used to that. So for me to lose my 14 pounds, so when I started off I was at 293, but now I am currently at 279. So you're gonna have to find a protein drink that works for you. After surgery, you're gonna be on a liquid diet, so they want you to drink protein drinks to get your protein in. They give you a list of protein shakes that you can choose from, and I drink the Atkins one. I really like that one. It tastes good to me. So in the morning time I'll drink a protein drink, lunch I'll drink a protein, and nights I will make my low carb meal with any meat I want and the non-starchy vegetable. They don't want you to have no fruit. So like, yeah, fruit is good for you, but it has sugar in it. Even though it's natural, it's still sugar. No fruit or juice, no milk or yogurt, no starches, and no sugar. That's what they want you to stay away from. And for unlimited snacks, you can have like raw veggies, sugar-free Jello, popsicle, decaf coffee or tea, and diet drinks. So that's the diet that you're gonna be on. I also had to go to a nutrition class. So the nutrition class is going to teach you, again, how you should be eating now, how you should be eating after surgery, what not to do, what to do. And it's also included in the binder that they give you. So the nutrition class was also really good because I got to meet people that are about to have the surgery just like me. And I met a friend there. Me and him keep in contact. He just had his surgery a couple days ago, so I'll be picking his brain like, oh my god, what happened? And we both have the same surgeon too, which is awesome. So he's doing really, really good, so that makes me feel really, really good, because I already knew my doctor was good, but that just validates that she's really good. So you also are going to have to see a therapist. They're going to want to make sure that you're mentally and emotionally stable to go through this process. This is a life-changing event. They want to make sure that you're going to be strong enough. So the therapist is just going to ask you some questions, kind of like about your daily stressors, why you want the surgery, just really basic questions. They're going to ask about your family history and like family medical history and stuff. So once you get the okay from the therapist, that's when they start to bill your insurance. So when you're going through all of this, you don't have a surgery date. So after they told me that I passed all these things, I'm still waiting for the therapist to come back. So I have other appointments actually. So I had to go see cardiology. So for my heart, they want to make sure your heart can withstand surgery. So I had to get an ultrasound of my heart. I had to get an EKG, just to make sure my heart was strong enough to get through the surgery. I had to go to radiology and get an esophagram, and that's where they test if you have acid reflux. So they like make you drink this really white, thick stuff, and they stand you behind an x-ray machine. They want to see if it'll try to come back up. So I didn't have acid reflux. You have to get a lot of blood work done, so they want to see like your vitamin levels. Like my vitamin D levels were really low, and that's very common among black folks. A lot of black folks' vitamin D is very low. They also made me do this breath test when I got my blood work done. I had to blow in this bag because they want to see if you have this certain bacteria in your stomach that could be really bad if you're trying to get this surgery. So they have to make sure that you don't have that, and if you do have it, then they'll have to treat it. So that's basically a list of all all of the appointments that I had to go through. And after I got through all of that, I got the okay from everything. Everything looked fine. My vitamin D was a little low, so they just prescribed me some vitamin D pills to take. The therapist approved me. So now they're billing my insurance. So once the billing of your insurance goes through, that's when you get your surgery date. So once that was approved, I got my surgery date for December 3rd. You get to pick what surgery dates you want to have, because you got to make arrangements with work and different stuff like that. But I picked December 3rd because I wanted it 60 days out from, 30 days off from when I scheduled, so I can make sure that I stopped all the things like the alcohol or whatever that you need to do. So I just had my pre-op appointment a couple of days ago, and basically just talking to my surgeon about any questions or concerns that I had, going over the surgery again, going over what's going to happen the day before surgery and stuff, and what I need to do. So I have to be on a full liquid diet the day before surgery, making sure that I'm taking the medicine I need to do 3 hours before surgery and stuff like that. So yeah, and then I also had a pre-op with a nurse, so she did some more blood work on me, checked my vitamin levels. My vitamin D levels were still a little low, so they prescribed me some more vitamin D pills, and that's where I'm at. So that's basically kind of in a nutshell everything that I went through to leading up to surgery. So I will be making another video probably after I have my surgery. I was gonna make a video before surgery, but it's not really much to tell because I pretty much told you guys everything. So after surgery, when I'm feeling a little better, I'm gonna let you update you guys on how I'm feeling and what I'm going through. All right guys, have a good one.